It's rather unfortunate because tuberculosis thrives where there is poverty.
The awareness creation is very key, very key. We need to bring it down to people's understanding, especially in rural areas, in the grassroots, where people that are not so educated and maybe they don't have formal education will begin to feel, is what I mean, what are they saying? I don't understand. So you need to come down to the level to educate them, to make them understand what this deadly disease can actually do.
Every year, 10 million people fall ill with tuberculosis (TB). Despite being a preventable and curable disease, 1.5 million people die from TB each year, making it the world's top infectious killer. TB is caused by bacteria Mycobacterium tuberculosis, and it most often affects the lungs. TB is spread through the air when people with lung TB cough, sneeze, or spit. The person needs to inhale only a few germs to become infected. TB is the leading cause of death of people with HIV and also a major contributor to antimicrobial resistance. Most of the people who fall ill with TB live in low and middle income countries, but TB is present all over the world. About half of all the people with TB can be found in 8 countries: Bangladesh, China, India, Indonesia, Nigeria, Pakistan, Philippines, and South Africa. In Nigeria, some of the states affected are Lagos, Kano, Ogun, Enugu, Ekiti, Ondo, Borno, etc. People took to the street to get reactions on tuberculosis spread. It's rather unfortunate because tuberculosis thrives where there is poverty. Access to good food, access to healthcare, when people lack those things, of course, with a kind of the environment that people live, you have many people living in that area, like you have like 200 people living in a compound. So when someone gets sick with tuberculosis, the rate at which it's going to spread is higher. And they also live in places where there is no proper ventilation, the environment is so dirty and all that. So it's a major problem in our country that the government needs to focus on. So we're not just going to focus on tuberculosis, we're going to focus on housing, we're going to focus on food, we're going to focus on healthcare assessment. That's the way I see it. Because if you just look at tuberculosis on its own, we're not going to get anywhere. What are those things that will make tuberculosis to be less in the society? Those are the things that we need to focus on.
Most especially, it's very important for people to be educated. We'll say if there is no smoke, there will be no fire. That means people need to understand the root cause, what is actually bringing about this pandemic, and what do they need to do. So the awareness creation is very key, very key. We need to bring it down to people's understanding, especially in rural areas, in the grassroots, where people that are not so educated and maybe they don't have formal education will begin to feel, what are they saying? I don't understand. So you need to come down to the level to educate them, to make them understand what this deadly disease can actually do and how it spreads. Then we can be able to prevent it. And also, when you're educating them, you're letting them know that even if you already contacted or you have symptoms, they need to be clear about the symptoms that they need to watch out for someone that might likely be going through it and where they can get help. Because it's two different things. You are preventing and you're responding. So if you are going to be preventing, you have to do a lot of awareness in different languages, in simplified languages for them to understand at the grassroots. Then when you are talking about the prevention, the response, that means you are telling them where services are available for them to be able to get help if they could sense or someone is actually going through this tuberculosis. So I think it's very important for us to be aware and also for us to know what to do when we have anyone around our surroundings that is actually exhibiting or the symptoms or signs. Then it's also very important for us to also be careful, hygiene, we have to practice so many things that also helps us to increase our own immunity. So I think that's also very key.
What I know is we need to go back to the old system of primary health care. I'm in Lagos Island. The nearest government hospital to me is Lagos Island Hospital. It's too far. If I have a cough or I feel ill, or I just woke up this morning not feeling well, there should be a small health center that I can walk into and say, oh, nurse, this is how I feel this morning. And then they do the test. So if it's anything big, then they refer me to the general hospital. But we have, I don't know whether it is also government, have killed those smaller hospitals that are friendlier. Your medical condition is something that you don't just talk about because of the society we're in. But if there's a friendly hospital, then you just go into the primary health care. It's you and the doctor, you and the nurse. No long queues, no traveling down there. Nobody's asking you to. And then this issue of once you enter an hospital, you must pay money before you see the doctor. So someone that has tuberculosis and the society stigmatize you. Once you have tuberculosis, they say, oh, you must have been fooling around, you must be a call girl, you must have had you must be a loose person. It's not. Tuberculosis is an air infection that you can pick up from even someone that doesn't know they have it. Most people don't even know they have it. Someone is coughing, says, oh, I just have a cough. They go to the chemist and buy cough syrup, which is wrong. If you cough for more than 3 days, you must go to the nearest primary health care to find out why you're coughing.
Tuberculosis is one of those underrated and underreported health conditions in Nigeria. I have a friend who works with an organization that does vaccines against TB, and I know that we're partnering with them to give vaccines to a set of girls for one of our outreaches in my office. So as I said, it's underreported. People don't think it's something that can happen to them. Meanwhile, this is airborne disease. So I think we should just have more awareness about it. Those of us who are in the media should talk about it more often, and we should commission more investigative stories about it. The more stories we tell about tuberculosis, the more people will get to understand and have much more knowledge about what it is. Right now in the country, so much is going on, and there has been a partnership with the pharmacists, and I think there's a lot has been accomplished, and right now in the country it's actually going down. The spread is reducing because there's so many inclusion. Overcrowded environment is a very, very fast way at which the tuberculosis issue can spread, and we should make sure that we feed very, very well. The feeding is the most important thing, and then avoid overcrowded environment.